Hello guys, I'm going to explain you today about the Oet listening, which is very important, and please try to listen properly because in a listening part C I'm going to explain today. In a listening part C, what thing is very important is there are different types of there are two different types I'm going to explain. Especially in exam you will get two varieties of the question in the part C, and one is a interview thing and second is a presentation. Which one is difficult is, to be honest with you all, it is a presentation because only one person will be there to explain the all this question. There is a 6 question 31 to 36, so only one person is going to speak, which will be very difficult to catch the conversation. However, there is a second type, that is a interview things. There are 2 persons where there will be the one chief guest and one is a questioner. Like when the interviewer is asking the question, the interview is when they speak, you should listen carefully to this question. When the questioner person is asking the question, that time you need to listen carefully. Once the chief guest is or the any doctor speaking of that specific topic, that time you need to go vice versa with the vocabs. If they are talking about preterm, then preterm particularly challenged by respiratory issues, then you should go with the vice versa, what things are there. Before that you are getting some minutes to read the question. That time what things you need to keep in mind is you need to take one of the keyword at the most. Intubation, since you have a minimal time, I like to advise you to take the minimal word, at least one. Intubation, physical discomfort and administration or adjustment. So once you are getting this question, when the audio is played, that time once you are hearing advantages of neonate, that time you'll need to listen. Intubation time you need to see whether all the words are connecting or not. If the words are not matched, some differences are there, then please try to match and try to understand by yourself and take the decision whether answer is right or not. This is a way to tackle in the part C. Anyway, I'm going to do now with the 31, 32 and 33. So remaining you can do as well, and this kind of pattern will come in your exam. So I'm going to help you in this video.
You'll hear 2 different extracts. In each extract fits best according to what you hear.
So please listen very carefully. What is the primary advantages of using non-invasive ventilation technique in neonate? Now we have to keep in mind intubation, physical discomfort and administration. So you just listen and then try to take the answer. So I will teach you how you need to take and why this answer is wrong and how this answer came. Okay, so I'm going to help you with this one in this video. So all the question you need to listen very carefully because why the preterm neonate also you should know that. And next this one, all the things you need to keep in mind.
Today I'm thrilled to discuss an important and often complex topic in pediatric care, particularly focusing on the advancements and challenges in non-invasive ventilation for neonates and infants. Recent studies have shed new light on this critical aspect of pediatric care. And today, we will dive deep into these findings, their implications, and discuss a pertinent case study that illustrates these concepts in practice. Non-invasive ventilation, NIV, techniques like continuous positive airway pressure, CPAP, and high-flow nasal cannula, HFNC, have transformed the management of respiratory distress in pediatric populations. They offer significant advantages over invasive methods, reducing the need for intubation, which carries higher risks and complications. Let's first discuss the physiological basis of these techniques.
So you can hear just now they are talking about the significant, the primary advantages they are talking about, right? Primary advantage synonym you can take in your notebook. Significant, the most significant non-invasive ventilation technique in neonate is, they are saying that reducing the risks of risks related to the intubation and reduces the complication as well. This thing you are hearing, right? So this is the exact answer. Avoid and reduces is the paraphrase that they have done. Intubation specifically they are mentioning. So your answer will be this, and these two things they are not mentioning as well. So please try to listen. First question we have matched significant, most significant invasive ventilation for the neonate, and they have clearly mentioned that it reduces the risk of intubation such as complications. So this is the answer for the question number 31. So please listen whether they are mentioning these two or not. If it is not and they are jumping to this aspect, then we have to look here. Okay.
Techniques, particularly how they cater to the unique anatomical and physiological characteristics of neonates and infants. Neonates, especially preterm infants, present unique challenges due to their
So you can see that they didn't mention these two things at all. They just mentioned the A and they just left over. Okay, so that means your answer is A. Now they are talking about preterm structures and all, and what are the challenge, and so they are going to say these three things. Now again you need to look what are the keyword: chest wall, atelectasis, lower functional residue. Okay, you can just give in residual capacity. So when you are hearing the residual capacity or complication or atelectasis or chest wall, you need to point to this aspect. Okay, now I will play again.
Underdeveloped lung structure, high chest wall compliance, and lower functional residual capacity.
So you can hear just now they have mentioned lower functional residue capacity. They are clearly mentioning that preterm neonate particularly challenge. They are having a different structures, and that lead to the they are also having a high chest wall compliance, means they don't have less. Okay, reduce means less, right? They don't have a less, instead they have a high chest wall compliance, which is wrong answer. And then they are talking about lower functional residue capacity, exact they are using. Now we'll see whether they are saying this B or not. We'll listen again.
These factors predispose them to atelectasis and other respiratory.
Right, now they are saying because of these two different structures are leading to the atelectasis. So what is our question is, they are saying that what is a particularly challenged structures are being found in the preterm. So being found is high structure chest wall and lower functional residual capacity. So more answer is going in number C, because reduce is not mentioned, instead they are saying high. And then number B is a predisposed. Predisposed means it is leading because of abnormal structures. The atelectasis and other complications are occurring in the preterm neonate. So this is a way to tackle in the part C. Listening.
Issues. NIV.
So now again they are finished with number 32. Again they are going to this number 33. So please listen. In number 33 again they will say this is a presentation, right? So she will say case study. Once you are hearing the case study and premature infant, please listen and go with the option. Once you are going with the option, you will get the answer. Especially variation mean maybe they will use some kind of paraphrase, ongoing assessment and flexibility. This word you should keep in your mind. Okay, now I will play again.
Techniques like CPAP help by stenting the airways open, improving oxygenation, and reducing the work of breathing. HFNC, meanwhile, delivers warmed and humidified air, which is more comfortable and can achieve similar effects to CPAP with potentially less nasal trauma and greater patient tolerance. A recent randomized controlled trial published in the New England Journal of Medicine compared HFNC with CPAP in neonates experiencing respiratory distress. The study found that while HFNC is less likely to prevent treatment failure compared to CPAP, it was still successful in a significant percentage of cases. This brings us to the importance of understanding when and how to use these different modalities effectively. Let's consider a case study to illustrate this. These effectively. Of unsignificant preventive medicine compared HF with potentially less HFNC.
Okay, now they are going to explain about the randomized clinical trial. This is present in the randomized clinical trial, and they are clearly mentioning now the case study regarding a infant, and that was initially baby was born and baby is having a distress. At the distress time, what they have done is they have put the baby into the CPAP, and CPAP, what happened is when the baby was in a CPAP, he was into some problematic, okay, some problem came up, and then they have changed again to the different measures. So they are saying personalized, right? Personalized means they were individual, and she was changed to the some other measures because in other children and all, other baby and all, they are okay with the CPAP. However, this child was not working out with the CPAP. Instead, they changed to the different because of individual response. So this is the thing only they are mentioning rather than number B and C. Again, I will play, and please identify how they are mentioning. This is a way to tackle in part C OET listening.
C, meanwhile, delivers warmed and humidified air, which is more comfortable and can achieve similar effects to CPAP with potentially less nasal trauma and greater patient tolerance. A recent randomized controlled trial published in the New England Journal of Medicine compared HFNC with CPAP in neonates experiencing respiratory distress. The study found that while HFNC is less likely to prevent treatment failure compared to CPAP, it was still successful in a significant percentage of cases. This brings us to the importance of understanding when and how to use these different modalities effectively. Let's consider a case study to illustrate this. We had a premature infant born at 32 weeks gestation, weighing 1,500 grams, who developed signs of respiratory distress shortly after birth. The clinical team initiated CPAP, which helped stabilize the infant initially. However, due to nasal trauma and the infant's distress with the CPAP mask, the team switched to HFNC. This switch was based on clinical judgment and the infant's specific needs and response to therapy. This case highlights the necessity of personalized medicine in pediatric care. It's crucial to monitor the infant's response to NIV closely.
So you can see clearly that they are talking more about they are clearly saying first randomized clinical trial, they have compared about CPAP and the HFNC, and they are saying that HFNC was more effective than the CPAP with the story of this case study, premature infant. And in the premature infant, one of the patient was born with a distress, and that distress was intervention was CPAP was provided at the initial. It didn't work out, and they have kept the baby for HFNC. So they are talking about this, and they are also telling that it is a depend on the personal requirement of the baby, as well as it is a different in the individual. So they are clearly saying about number 1 rather than B and C. This is a way to tackle in part C, listening. If it is a presentation, this is quite easy, right? So same thing is that, but you need to listen very, very carefully with what things they are mentioning. Then your hand should go, when your hand is towards the option, right, that time you should know reduce means high. You should be careful with this. Your concentration should be here, should not go there and there. Most of the students, what doubts they are having is they are quite worried that the sometimes 34 the vocal audio will play 35 ahead than the 34. That is not going to happen in the exam. I can say that it is seen in the YouTube and some of the platform for the practice, but it is not going to happen in the exam. That I'm going to tell you all. Please do not hesitate much when you are into the part C. Just be relaxed and get through that. Listening is very easy, and everyone will get if you are a nurse. That I can say that because it is very easy, and it has a more scope for the nurses or any medical profession to get through the listening, because listening is just a common language that they are using, not too complicate, but your listening power should be improved. That you will improve. In my point of view, I like to say you that please listen the podcasts or Spotify. In a Spotify you will get a lot of OET listening and all during your exam or near to your exam. If you are having a certain days, please try to listen those things, and I'm sure you will get through this and get habitual with the listening practice, and you will hear everything in an exam even you don't want to at all. So you will get clear the OET without any trouble, that I can guarantee that. So please try to study and try to listen, not the English song only. I can see that some of my students as well, they were mentioning that they are listening the English song, and since you are listening the English song doesn't mean that your listening will improve, because this is kind of therapeutic, I can say, but you are listening to the audio that we are playing, right? Practice time, same one you are listening every day as the way you are listening music. I'm sure you will get the high score rather than listening to the music. Please try to practice in such a way, and if it is interview, it is going to be more easy, I can say that. So please try to practice the remaining thing as well. And this OET is from the Maggie Ryan. It's very good in my point of view, and it is on the 13/10/2024. You can practice that and let me know in a comment how much you got from this one aspect. Anyway, it is very easy as well, and all the best guys, and catch you in the next videos.